So if a patient cannot take bisphosphonates, doesn't explain the reason why, are there other bone building therapies that are recommended to protect from bone loss?
Sure. So I would say that while we talk about these drugs like bisphosphonates, rank ligand inhibitors, there are some other drugs that can be used to strengthen the bones. Because you can imagine these bone strengthening agents are used in a lot of different cancers, breast cancer, prostate cancer, etc. So this family of drugs can be used. There are some that are used less frequently, but can be used instead of bisphosphonates and denosumab. But I would bring the patients back to even more basic stuff: calcium, vitamin D, exercise, bone strengthening exercise. These are the first steps, then come the other bone modifying drugs. So even if a patient has been told that they cannot get any of those drugs because of the side effects, they could certainly take calcium vitamin D after discussing with their doctors, and they can regularly do some bone strengthening or bone building exercises. Sometimes it's as simple as swimming, as simple as spinning, but those are like on a stationary bike. But those are extremely important activities to help build bone mass.
All right, thank you. Have you ever had a patient that has reached complete response that you've said, well, maybe you don't need to continue on bisphosphonates? Is that ever an option for patients to not continue after a certain period of time?
So again, excellent question. And in fact, historically, all the bisphosphonate related clinical trials had up to a 2-year follow-up. So a lot of times we used to say, well, at 2 years, we have to stop them because there's no safety data beyond that. But more recently, there are studies that have shown that even every 3-month bisphosphonate is as good as every month. So if somebody has active bone affecting myeloma, then their treatment can be given every month or every 3 months. But if a person has gone into remission, and remember, the myeloma was the inciting event that was causing the bone loss. If there is no disease, if there are no active bone lesion, and the person is in good health, they are active, no bone related issues, you've done imaging, everything's good, I think it can be done that the bisphosphonate can be stopped. And of course, this needs to be actively discussed with the patient. But frankly, other than having the side effect concern, if I can have a patient not come in for a treatment and they can spend that much extra time with their family doing what they want to, I think that's a win-win.